Good evening, New York City, and thank you so much for tuning in today, where we're having a panel discussion on a history of the war on drugs. Will it last from yesterday to today, and will it last forever? So we're grateful to have on this panel some legislators, individuals who have lived experience, who work with specialized expertise, and individuals who work with the media to spread the knowledge of what the impact of the war on drugs has done to our community. And again, we're so grateful to have each and everyone on this panel today. And we want to just kick it off with an understanding of how the war on drugs has impacted the lives of particularly Black and Brown people in this country. The criminalization of drug use has led to so many hardships, so much pain. And so we're just grateful for all of you to tune in, to listen to, and hear solutions about what we can do to move forward, to heal, to bring restoration, and to bring justice to the people. So again, good evening, New York City. I'm Solomon Acevedo, the Deputy Public Advocate for Justice, Health, Equity, and Safety here at the Office of the New York City Public Advocate. I use he, him pronouns. And I want to just set the frame tonight by thanking our State Senator Gustavo Rivera for being here. And early this year, the state senator had introduced a bill to eliminate criminal and civil penalties for possession of controlled substances and establish the Drug Decriminalization Task Force to develop recommendations for reforming state laws, regulations, and practices so that they align with the stated goal of treating substance use disorder as a disease rather than criminal behavior. So I just want to kick it off to you and ask you, how can the legalization of all drugs lead to a decrease in violence, overdose, and inequitable impacts of criminalizing drug use?
Well, first of all, thank you so much for the invitation to the public advocate, Jemani Williams, and also obviously you, Solomon, for having me here this evening, as well as this distinguished group of folks that I find myself with. These are brothers that I fought with, and who have educated me on quite a bit in the time that I've been in the legislature. Well, let's just start with facts. The drug war has not worked. It has been an utter failure. The only thing that drug war has done is to over-criminalize particular communities and have a horrendous impact on communities across our country for its entire existence. We have not, this criminalization, this idea that we can arrest our way out of any type of addiction crisis or overdose crisis has never been true. It has never been true. And so we have to do something different. So the bill that you refer to, I'll get to that in a second, but I want to talk about a couple of other things that lead up to it, because I think that I start from that perspective that, first of all, that because both drug use and more specifically addiction is a public health issue, it must be dealt with as a public health issue. To deal with it with the criminal justice system does not work. It does not make people healthier. It does not make our communities healthier. It costs money. It destroys lives. It destroys communities. So we have to do things differently. And that's what, again, the gentlemen that you're going to have this evening here, certainly many of them have taught me over the years because of their own lived experience. So there's a few bills that I've introduced and I've passed over the last couple of years. One of them related to the opioid settlement fund is that to make sure that monies from settlements with pharmaceutical companies and opioid manufacturers, that these are folks who made a killing off of the deaths of so many of our sisters and brothers. We want to make sure that every single one of those dollars that comes to the state of New York through settlements, goes through treatment, goes through harm reduction, goes to recovery. And that's something that we passed a couple of years ago, and we're making sure that it's implemented correctly. And I'm also the proud sponsor of a bill to authorize overdose prevention centers across the state of New York. Now, there's 2 of these facilities that are already working, and I'm sure you'll talk about them more at length. And I'm incredibly proud of the work that those folks have done in saving lives every single day. And look, this is the reality, and I'm sure that we'll talk about this. This is not about encouraging anybody to use. That's not what this does. What we're talking about is a harm reduction strategy that moves in a direction of actually keeping people alive. And that leads me to that last bill that you mentioned, which is a bill that would decriminalize drugs, like has been done in places like Portugal. And this is not, and to make sure it's something that we should work towards, because the fact is, I said again, overdoses, addiction, these are public health crises. They're not, if we keep treating them like crimes and we keep treating people who use drugs as criminals, we're not going to solve anything. We're not going to cure anything. We're not going to make them better. It's only going to cost us money. It's only going to further destroy our communities. We've done that enough. And I believe that we have in front of us a set of things that we can do to move in a direction of treating people that use drugs as people first. That is shown to work. And we're going to talk about it a lot this evening. And that bill would go a long way towards that.
Yeah, thank you so much for sharing. And you mentioned a little bit about being inspired by the people who are on this panel and their lived experience. Can you speak to the ways in which speaking with people who have gone through it actually sheds a deeper light on the way that policymakers make decisions?
Absolutely. There's a brother on this call, and he's not the only one, but he's here, so I'm gonna mention him. I'm gonna shout him out. Terrell is here. This is a brother that I've known for certainly my entire legislative tenure. So 13 years I've been in the legislature. And I remember very early on, a lot of folks from an organization called Vocal, probably heard about them before, came to my office to tell me about the work that they do every day and some of the experiences that they had themselves. And so it was incredibly important for me because when if I tell you my story very simply has been one of privilege, not of struggle. I've been incredibly lucky and privileged in my life. There's a lot of things that I've never experienced. I've never been arrested. I don't have family members who are arrested. I've had very few people in my immediate circle or even in my a little bit farther off circle that have any contact with the criminal justice system or have been has had issues with drug or addiction themselves. So there's a lot of these things that I had no idea about. And it was through the experience of these individuals telling me how the decisions that have been made by policymakers long before they ever got into the scene impacted their lives on a day-to-day basis. And me seeing these folks as individuals, as human beings, who certainly had a lot to say about how these decisions made without their involvement had impacted their lives and their communities. And so it just made it so that I want to make sure that they are at the center of my thinking. When I'm thinking about how to solve a problem, it was a friend of mine, Glenn Martin, who said a while back, and I always remember this, people closest to the problem are closest to the solution. I believe that to be true. And so it is folks like Terrell, folks at Vocal, folks at Drug Policy Alliance, folks at Housing Works, et cetera, who've educated me throughout the years, and they remain at the center of my thinking about how I approach these problems. And certainly on point. Can't forget on point because they are, as the name implies, they are on point.
Indeed. Thank you so much, Senator. I really appreciate the time that you took to be on here. I know you have to do many important things, but we're super, again, grateful for you being able to invest time, not only in listening to the hearts of the people, the struggles of the people, but then taking action and making sure that our lawmakers are held accountable to do the things that build power and save lives and change the way that we live to a more harmonious community. So
and lastly, I'll leave you with one last word, not just listening to them about how things how things need to change, but then keeping them at the center of the conversation. And as a policymaker, it's important for me to just say that I want to keep them at the center of the conversation. We'll continue to do that, and looking forward to continue to work with them to just set up the system in a better way. We need to save the lives of our sisters and brothers. I know that we do that every day. We'll do that some more in the years to come. Thanks for having me.
Thank you so much, Senator.
Thank you, Senator.
Have a great rest of the day.
Thank you.
So here we are, and we're again grateful to have State Senator Gustavo Rivera, who again is a champion of so much legislation that leads us forward on a statewide level to get to the place where we need to be to save lives and to, again, address the failed drug war with true solutions that will help individuals actually transform their lives. And interestingly enough, we know that the drug war is a war that was waged not only to criminalize drug users, but its disproportionate impact is on the Black and Brown community. So the overwhelming increase in incarceration attributed to the drug war has disproportionately impacted Black communities to the point that in 2011, Black people were incarcerated at a dramatically higher rate than white people, 5 to 7 times. And it accounted for almost half of all people incarcerated with a sentence of more than 1 year for a drug related offense. And so I want to ask this panel, and as you guys begin to share, also introduce yourselves and where you're from. Uh, I want to ask you all, how does racial inequity play a role in exacerbating the problems related to criminalization of drug use? And how does this impact access to treatment and other life-saving resources? And anyone can go ahead and try to tackle that. So don't be shy now.
Excuse me. I am Hiawatha Collins. I'm a board member of Vocal New York. I'm the community the community and capacity building manager for the National Harm Reduction Coalition and founder of the Peer Network of New York. So I want to thank you first and foremost for having me on this panel and a part of this discussion. How does this impact the Black and Brown community? First of all, let me say this. The war on drugs we know is a war on people. If it was a business, it would have been out of business a long time ago because it has not been a success. But at the same time, it was done exactly what it was designed to do, and that was to lock away, up and away, Black and brown folks. So when we look at this and we hear this, what does that do? It destroys the families. It separates the families. It makes it harder for people to get jobs, to even get education. So we need to make sure that we understand that by design, this family structure within the Black and brown community has been destroyed. When it comes to getting jobs, education, this war on people, which we call the war on drugs, has stopped people from elevating within the community. Socially, you can tell a society by how it treats its most vulnerable populations. When we take care, when we look at those individuals who use drugs, when we look at individuals that are homeless, and we look at low income individuals in our society, why aren't we making it better? When it comes to the things that we're talking about today, the governor's bills that's on the table, when we talk about on point and things like this and safe consumption sites, the community has asked for public injection not to happen. Has asked for syringe litter not to happen. So these two sites, syringe litter is not happening in the community, it's happening inside. So there's no waste in the community. There's no people publicly injecting outside. So it has cleaned up the streets. Now we want to know why this happens, because as I stated, it's by design. And we cannot get this when we're locked away and we're locked up and we don't have the same rights, or we can't make bail because it seems to be we seem to be targeted. We seem to be arrested at higher rates. And this does not that we seem to be, these are actual facts. We need innovative leaders like the public advocate and the governor of this state who has made promises that they have not kept. When we look at, we must make sure that these innovative leaders make the decisions that they can make for the community of marginalized people. We must make sure that they are able to make the decisions that need to be made for these life-saving efforts within harm reduction that we're talking about. These life-saving efforts are sound science. They have asked us for 30 years for sound science, and the harm reduction community has been providing it. Now, this is not about condoning, condemning, endorsing anything. We don't do that when it comes to drug use. But what we do is we provide a service for individuals so that they can be alive, so that they can be able to make a decision, and whatever that is that they choose to make. I'll leave it right there for right now. Thank you.
Good opening hire. My name is Terrell Jones. I'm the community advocacy and community engagement manager at On Point NYC. I'm also one of the co-directors for the Peer Network of New York. I'm also a senior vocal leader. Sit back and talk about the impact. Criminal justice system devastated my life because I was a user selling drugs to supply my own habit. And unfortunately, my choice of drug was crack cocaine. And at that time there, the media portrayed people who use crack as demons. With all these horrific stories that were being run on the news, in the newspaper about how people act when they smoke crack, you know what I'm saying? My first offense, going to getting locked up, I was offered first 9.5 to 18 years in prison for a $10 sale. And you trying to give me time like I'm a kingpin. I wound up doing 4.5 to 9 years in prison. But what hurted me the most was being in the courtroom with other individuals who did not look like me, had the same charges, and they went home to Staten Island, Long Island, upstate, to their little picket fences and houses. And I had to do 4.5 to 9 years up in the state penitentiary 5 miles away from Canada. Day and a half for my family to come visit me, and they only came once because I did not want to put them through the shame that they had to go through of being strip searched by these officers. I had no human contact with no one that I love. I grew so angry and mad that when I came out, I used more than what I started when I was out there using. Because the prison justice system is not a system designed to help you address your addiction. It's there for criminals. And when I was in Rikers Island, I couldn't believe where I was placed. As a drug dealer, I went to HDM, higher security on Rikers Island, a place that's for rapists and murderers. And here it is, I'm a drug user. And this is who I'm locked up with. I had to be fearful and fight for my life on a daily basis. This is where all the resentment came in and the anger for the criminal justice system, because it was not there to help me. It traumatized me. It made me angry and mad at the system. So when I came out, I had reservations already to use drugs. I was angry. I wanted to get back at people, and this is the way I thought. Because there was no help in there for me. Every day that I walked those corridors, I had to look behind my back to make sure I make it home. Because one of the things about the criminal justice system is very easy to get out, but it's hard as hell to get out, to get in, but it's hard as hell to get out. I lost contact with my kids. While I'm going back and forth to court, how the judge portrayed me as a menace to society in front of my family, in front of my children. I was a demon out there involving and killing people and changing people's lives and this and that, you know what I'm saying? The picture that was portrayed to me, I couldn't believe that the judge did that in front of my family and my little kids. This system needs to be abolished. People who use drugs need to get into some type of treatment, whether it be abstinence, harm reduction, whatever it is. Criminal justice system is not the place, again, like I said. Because some people who use drugs that go into this system, they never make it home. Thank you.
Thank you so much, Terrell, for sharing. Anyone else want to chime in on the disproportionate impact on Black and Brown communities regarding the criminalization?
Yeah, I just want to add, you know, just to enhance what's both Terrell and Hiawatha said. I mean, first of all, thank you, Solomon, for the invitation to the panel. And quick introduction: my name is Jason Beltry. I'm the director of community initiatives at On Point NYC. I just wanted to add that, considering everything that was spoken of, right? If we scale this impact up, the impact that the war on drugs has had, like we're talking about this on multi-generational levels as well, right? This has been happening for a long time. So so many community organizers and leaders lost to the youth because of this drug war and the underhanded policies and tactics that were deployed before, and then just the impact also on the ground level. So like it impacted me like the same way it impacted so many other Black men in America, Black and brown men, right? I mean, we're talking about police contact on a frequent basis, just commuting to and from work, or just being a citizen in the streets. Like, that led to so much unwanted encounters and assaults even by police, even though me personally, I was not in the street like that, right? So I just wanted to add that, like, it's like on such a grand scale that it is time for abolishment and some change.
I want to add something real quick. It didn't matter whether I had on a suit or I had on a cap tilted to the back or to the side. I could be in a suit on the way to work, or I could be in khakis with a baseball cap on, and I would get stopped. And sometimes I would wonder why. What did I fit the description? Why was I getting stopped? For what reason was I getting searched? And sometimes it didn't even, I could ask the questions, but if you ask the questions, you're being told you're a smart ass, or you don't need to know. You don't even, the rights that you're supposed to have as minority men, we get treated less than, like we can't speak up or we can't stand up for ourselves or our rights. And the worst thing is when these things happen in front of your young son. How are you supposed to teach your young son how to be a man and how he should carry himself if you're being accosted and belittled in front of them? I mean, the family structure, as I talked about, the lack of being able to go to school, the lack of not even being able to get a proper job. And even when you re-entry and come back into society, no one wants to hire you because you're labeled now. The stigma that goes along with being formerly incarcerated, the stigma that goes along with that, the labels that go along with that. No matter how many skills you have or how educated you may be or have gotten, it is harder to get a job, to get housing, or anything after having said police contact, just from, and it could be from mistaken identity. You're thrown in a bullpen. You might not be able to make bail. Now and then you lose your job, you lose your housing. If you're in a shelter, you lose your bed. You got to start all over. All these things by design discourages minority men and it attempts to break us down. But like what was said by a famous woman, y'all should know her name. Still, we rise.
Still we rise indeed. We talked a little bit about already the backdrop. The war on drugs, we know was a calculated attempt to try to clean up the face of what we know is historic disproportionate crime and poverty. And so when we talk about what solutions, like the senator touched on at the beginning, there's some other things that are happening for sure. And part of that has to do with how we tell stories. And so I just wanted to kick it off to Alex to see if you want to introduce yourself and just talk a little bit about the ways in which media plays a role in the way that we see criminalization.
Absolutely. Good evening, everyone. Thank you to the Public Advocate's Office for having me here. Blessings to all my amazing co-panelists. My name is Alexander. I am a journalist I report about the war on drugs for Filter magazine. And so I'll share a few things about the role of the media in the war on drugs. So because the war on drugs, by its nature, it's a political campaign. It's a political campaign that's been ongoing for decades now. Because of that, the media, of course, plays a huge role in framing how we think about it, how we talk about it, and the and ultimately how that translates into policy at the local, state, federal, even international level. Unfortunately, the media, I'm talking newspapers, radio, television, all aspects of the media. The media has been on the wrong side of this for a very long time, all the way going back to infamously, there was stories in the New York Times about police officers in the South shooting at Black men that were high on cocaine, and the way that the New York Times wrote about that, you could read it today. There's no denying that the coverage of it, the way they framed it, was incredibly racist. But going back into even today, we're 50 years out from the war on drugs. And the media is still one of the institutions that, unfortunately, still does a lot of the work to uphold the war on drugs and the policies that make it possible. And it even comes down to simply the language and the words that we use. So, for example, we talk about junkies, addicts, right? So already we're taking people who use drugs and we're using language that dehumanizes them. Criminals, convicts, ex-cons. We're taking away what makes them human, and we're defining them entirely by either their drug use or their criminal history. And then, of course, at any time that there's a proposal to change drug laws, whether that's legalizing marijuana, whether that's reforming, whether that's ending criminal penalties, whether that's reforming, say, resentencing and ending mandatory minimums. You see in the discourse now about prosecutors that are choosing not to prosecute nonviolent drug offenses. The media institutions that talk about the major newspapers and the media outlets, they're always the first ones to question, well, isn't this going to lead to a spike in crime? Isn't this going to lead to a spike in drug addiction? If we open these overdose prevention centers, isn't that going to lead to people shooting up on the streets in our neighborhoods? And isn't that going to lead to more discarded syringes on the streets? And so it makes it very difficult for those of us that are fighting to end the war on drugs, because already from the start we're fighting against all of this propaganda, and not only are we trying to re-educate people, but we're trying to de-educate people because of all of these lies and all these propaganda that people have been reading and hearing for decades now. So I think the last thing I'll say is that I see my role as a writer, as a journalist, it's twofold. Obviously, I want to advocate for policies and proposals that will start to end the war on drugs and abolish these systems that we're talking about. And also, I want to echo what Senator Rivera said. He talked about the people being closest to the problem are the ones that are closest to the solution. And he talked about some of the people on this panel today that he wants to keep them at the center of the conversation. I see my role in a very similar way. I have a platform. I have a mic as a writer. There's people that read my stories, and that's a power. And so I in the same way, I want to keep all of you at the center of this conversation, because obviously you are the ones that have those lived experiences. You're the ones that have seen firsthand what the war on drugs has done, and you deserve to have a voice at the table for what comes next.
Thank you so much, Alex. And you're 1,000% right around the influence that the media has. And so we're grateful for Filter Magazine, that's always promoting from the ground up stories around the other perspectives that are not shared around harm reduction and the ways in which the war on drugs has harmed people explicitly. And so we know that the problems exist. We know that there's limitations in the way that the general public sees things, but still we have these fighters, freedom fighters, that are working on the ground, folks on this call right now. And, we have in New York City, the first 2 overdose prevention centers ever run by the individuals who are on this call right now. And it's something that at this office, we've been working really hard to raise visibility for. And so last week, the public advocate went to visit. This is second visit. This one was to On Point NYC in Harlem. And he went to observe the unique services provided by this overdose prevention center. And while overdose prevention centers in New York City have reversed over 700 overdose, engaged nearly 2,500 users, facilitated over 50,000 utilizations, and have collected tens of thousands of syringes in the past year, there's still some community members who still doubt the positive impact of this service. So I just want to open it up to the panelists here and ask them, what makes overdose prevention centers an effective option to deal with the damage and distress caused by the war on drugs? And how are OPCs different from other approaches?
I guess I'll start. So OPCs, why are they the most effective option? I mean, even through practicing harm reduction and the work that happens in the OPC is really the most humane option, right? As far as our mission goes to rehumanize the people who use drugs experience and destigmatize, the behavior and the activity, everything that is associated around that. At On Point, we treat people with compassion and care. We offer them a safe and dignified space for them to be in and exist in, and not only to use, right? It also, provides an opportunity for community that is not, out in an encampment somewhere. It's life-saving. So as Solomon mentioned, we've intervened in over 700 overdoses. And it's not only about consumption here at On Point. We have an entire network of a continuum of care, really, where we have additional programming. So not everyone that actually comes into the space is there to utilize the OPC. Some people are there for a meal. Some people want to come in and get a shower or do some laundry, right? Some people want to come and talk to a medical provider. So there's a whole continuum of care that we have and that we provide to our program participants, where people can just come in and take advantage of. While some people, well, maybe the initial draw may have been the safe consumption, right? But once those relationships are built and that rapport is there and the trust is there, where those barriers are knocked down and that engagement really happens and all these services are available. So we've really taken off our program participants, their day-to-day survival needs. So now we can really talk about getting down to the core issues, which are like, usually homelessness and food insecurity and treatment and medical care. So it's just it's effective in that way. It's also saved the city, an immense amount of money. We want to talk about impact, and we can talk about the lift that we've provided to emergency responses, right? These 700 plus overdoses, we've only called EMS a certain less than a dozen times. So out of these 911 calls, they're happening only because of underlying causes. So let's say a seizure that occurred after an overdose, or an overdose that occurred towards the end of the OPC shift. So we're going to discharge care to 911 so that they can continue to monitor the situation. But in all reality, our staff that do amazing work inside the OPC and are intervening in these overdoses are really are doing great at symptom management and intervening at an optimal point in which we're actually just preventing the overdose from happening. If we want to talk about dollars, right, then we can talk about the cost effectiveness of, what does it cost to run an OPC currently, right? Or what does it cost to run one for 24 hours versus how much money also we've saved emergency services. But I can let, Terrell, if you feel the need to, or I can keep going.
I mean, my aspect of it is someone who was a former user. I didn't have the luxury of having the OPC, but I had harm reduction. It was a place of hope for me, a place for me to go unwind, the place where I could go where there was trust, something I didn't get in the other treatment centers that I got because of the trauma I was dealing with from childhood. And that trauma was never addressed in treatment programs. I went into a specialized group because it was recommended to me to go sit there and just listen. And when I heard individuals speak about the trauma they were dealing with the same as mine, I found a place where I can address that issue, where I can feel safe and not the finger being pointed back at me. I stayed because now I have some place to work on this issue. Now I have a place where I can put my resume in to get a job, but I also volunteered. And in that process there, managing my drug use till I stopped using drugs. And I've been at New York Harm Reduction, which is now On Point, over 18 years. Understanding the fact that OPCs are not the only answer. We need more. We need to address affordable housing. We need to address jobs. We need to address medical. We need to address mental health issues, because all these plays a part in why people come into our center. And if these issues cannot be addressed, this is going to continue. Nobody wants to be out in the street using drugs. People want to be in their house. You look at the individuals in the Hamptons, spend $30-40 million on their drugs, every couple of months. They're in a lavish place where they could use without being bothered. And nobody is saying a word to them. But my people in my community, we can only go buy a $10 bag, $20 bag, $20 bag, most $100. We have to go to the street every day and cop. Where these individuals could cop one time for a month and be secured, you know what I'm saying? But they have a place to live. They got money. They got resources. They got assets. We don't have that privilege here in my community because so much has been taken away from us, you know what I'm saying? If you look at this war on drugs, and I'm going to leave it to Hiawatha, my man, next, because I know he got something to say. You look at why we're losing the war on drugs, because the United States runs on profits, currency, capitalism. And if you look at the money that's being made off of the drug on war, we are putting a lot of money in people's pockets, man. The criminal justice system will fall apart without the war on drugs. But getting back to OPC is just only a small part of the continuum that we need. No one, we can never stop people from using drugs out in the streets because people have their own practices, their culture, their rituals, you know what I'm saying? But we have taken a lot of that from off the streets. Are we ever going to be perfect? No. And we don't set ourselves up to be perfect. And I just want to bring that to people's attention because they feel because we have these centers, everyone is going to use it. That's a false reality.
Why?
Patient choice is definitely a big thing.
Yeah, I want to say this. Why OPC so important? Why is harm reduction program so important? They both are one and the same. Is because they give the community member a sense of belonging. A lot of people, we don't know why people use drugs, but we know people are using them, right? But now most people who are using and become homeless or are out in the street, most of these people have had doors closed in their face. Think about some of us when we see a homeless person and we turn our nose up and we hurry up and run past them. This is still a human being. This is still a loved one. This is still someone's child. So when we in the harm reduction community meet people, we still treat them with dignity and respect. We give them a sense of belonging. And we don't judge them. We try and get to know them. We call them by name. It's not F you, get out of here, you ain't nobody, ain't you ready to quit this yet? Ain't you had enough of that yet? They already heard that enough times, and they may be even saying that themselves. But meeting them, offering them a cup of coffee, giving them a sandwich, making them still feel and realize that they still are a part of community, that they still have a voice, that they matter, humanizing the situation, letting them know that we care about them and that they matter. And then thinking about the OPCs, it is not just a place where people go to use drugs. There's other resources there. That's the most important thing. As you already heard, most of the people that go in there don't even use. They go in there for the other said resources. But having this there means that people don't have to use alone. Most of the time when someone overdoses, it died because they are alone. And inside an OPC, they are not alone. There is a professional individual there with them and that can notice the signs of an overdose and that can save that person's life. And I hate to even say what I'm getting ready to say, but dead people don't recover. They don't get a second chance. And in this country right now, 108,000 is way too many in 1 year to die from something that is preventable. And we have been providing sound science and research, and it's being done in other countries. Why it can't be done here? This life-saving effort, this cost-effective effort. What are we waiting for? Does it have to impact other communities more than it has already? Because this is the only reason why we're really even having this conversation now. If you really want to be honest, the only reason why we're having this conversation is because it impacted other communities just as much as it impacted Black and brown communities. In the 60s and 70s, right here in New York, we were still having some of these same conversations. And it was predominantly Black and brown people. No one wanted to put a methadone clinic, an OPC, a harm reduction agency, nowhere around that. But now today, because it's we want to do something about it. Now we want to do something about it. All we want is for the same opportunities. Let some of that money and those resources trickle into our communities, and let's make it work. Let's do the life-saving efforts that we know can save lives so that people don't have to die from something that is preventable and that other countries are doing way ahead of us. We used to lead the world in everything. Now we're behind the times. Something's wrong with that.
I mean, how you hit it on the head?
Yeah, you really did. I was gonna say, a prime example is like Black and brown folks couldn't even get tuberculosis testing. Right, the young lawyers had to go and commandeer an X-ray vehicle from whatever affluent area it was in. So we're still having that same conversation.
The health disparities in our communities.
I mean, we having these conversations, and it's being looked at because 2 years ago, when the epidemic was attacking those individuals who had the white picket fences in their little houses, it became a real big issue in their community. And the overdose problem was addressed. You look at the resources and money that was spent in those communities, and you looked at the overdose rate in those communities has dropped dramatically. And what we're saying is, how come we cannot get the same proper help that those individuals get? Because we know this is a racist war. You will let us die off and save your own. But we are entitled to have a decent life to live on this planet, man. We're human beings too. We got families. We love people. People love us. Why can't we get the same respect that they're getting in their community? Why we can't get that in our community?
One community, one people. That's what we need to be and should be. And it's a shame that it's not. It's almost the same as like what you described, Terrell, as having, one justice, but one set of laws, but two justices.
Mm-hmm.
You get treated this way if you come from this community or look like this. You get treated this way. The same thing with the health disparities. Why do we have high rates of asthma, diabetes in our communities? Why when I go to the fruit stand, my fruits and vegetables look this way? When I go to a certain part of town, yours look that way and are fresher and better. You know what I mean? We need to change the whole approach. This is 2020. This is 2023. This divide in this country, we don't need it. We all have a right to health and dignity, liberty, housing, all these things we have a right to, and we should all have them. We don't need scare media tactics. We don't need fear mongering. We know the truth. And if you look at the truth and look up the truth, you will see things for yourself and know that the things that we're talking about are life-saving efforts. And it's not just for the Black and brown communities, it's for all of us, so that none of us have to lose anyone. And the next holiday come around and we got another empty chair.
You know, most of the overdoses in this community occurs when our center is closed. You don't know how many, my Lord, my God. Know how many times we have to come in the weekend and may have to identify somebody who's been dead over the weekend that normally use our services, couldn't use them. And we'll call to identify those individuals. And these are people that we work with closely. These people were our friends. We built a relationship with them. We probably shook hands with them or gave them a hug before we went home for the weekend. And then we come back, man, they no longer here. Tired of dealing with this vicarious trauma.
That's right.
Why we have to come to work every day and look forward to something like this, man?
Know that somebody's going to die. We're going to lose somebody.
Why? Why do we have to go through this? When this could be addressed.
Yeah. And that brings up another point that, we should continue to insist that the governor do the right thing and sign an executive order to authorize opioid.
That's right. Release that opioid settlement money. Let me say this. What does a drug user look like? Don't be surprised if some of your best friends use drugs and you just don't know it. This thing here is not impacting just low-income people. A drug user can be black, white, brown, green. It impacts social economics from low income to the rich and famous. And you won't know if someone has an issue. Only reason why you know predominantly black and brown folks have an issue because they're in medium to low incomes. So they go through other things and they don't have other set resources. They can't go away to Betty Ford and say they had alcoholism. People know what problems they have because they still got to maintain and pay their bills and whatever the case may be. But when you come home, and because most of these people are using alone, and then you find your loved one died of an overdose, then and only then are you going to want to pick up this issue, become part of this issue, and wonder why? Please, you don't want to wait until then. This issue does not impacts all race, all social economics. It does not discriminate. So don't you discriminate.
Thank you all for sharing on that. It's difficult to for the, I think the general public to really see the difference. So I'm glad folks were able to identify things that are unique about the overdose prevention centers. There's been a lot of critical feedback, especially near the Harlem Center, around oversaturation of drug treatment programs. And I just wanted to emphasize the differences that were just spoken about. Unlike a methadone clinic that is providing you with a single service, an overdose prevention centers, as you are mentioning, is offering you more than just the service of making sure that people stay alive while they use, but also supportive resources for their entire life to be rebuilt. And I think that that's a key piece that people aren't emphasizing. And I think that there's some things that were mentioned here just now about what can be even more enhanced. And I want to kind of move the conversation into like what more can we do? And I think the state authorization from the governor, 24 hours of operation for our New York City centers, and there's also some additional things that could probably enhance the service delivery that's already taking place. So I want to just talk about healing this nation and ourselves and the future generations. And it's clear that there's new innovative, non-stigmatizing ways to engage people that use drugs, and that these things can help address the vast amount of trauma that's being experienced. And so I kind of want to turn the conversation to Alex and ask, like, what type of healing needs to take place on a political level, on a social level, on all levels around the war on drugs, and how do we, as a community of people who are in media, people who are in service, people who are still, struggling to find their way through using, how do we get to a place where we can overcome the negative impacts of the war on drugs?
Thanks, Solomon. Yeah, obviously that's a huge question. But here's what I'll say, and I'll bring it back to the OPCs. So you guys were talking about how people come into the overdose prevention center, and it's not just that it's a place where they can use these drugs under supervision, which is fantastic.
Yeah.
But as you said, also you get a cup of coffee, you get a sandwich, you have a place to sit down, you get, I didn't even know this, but you get a shower, you get laundry. And then you also get connected to other services, whether that's substance use treatment, mental health, housing, so all these different services. So everything is under one roof. And so I think that is kind of a perfect metaphor for thinking about this problem, right? How do we move past the war on drugs? Because just imagine this for a second, right? What if tomorrow the governor of New York, the legislature and the governor of New York voted to completely decriminalize all drugs, right? Completely end all arrests and imprisonment of people for drug offenses. Okay, great, right? But no, not great, because we would still have a situation where there are massive disparities in terms of housing, in terms of affordable housing, in terms of healthcare, access to medical treatment, access to education and jobs and economic opportunity. So, and obviously none of these problems are separate from each other. It's not a coincidence that we've been talking throughout this whole panel about how the war on drugs has very unequally affected Black and brown communities in the US. And it's not a coincidence that these are the same communities that are being hurt the most by our housing, our healthcare, education, economic policies, et cetera. So I think what I want to see everyone that's involved in this movement and anyone, residents, voters, anyone that cares about these issues who wants to get involved, let's think about the bigger picture when we're talking to our city council people, our mayors, our representatives, our governors, our senators, whoever it is. Make it clear that we need to make our communities whole, and so we need to demand equal access to all these different resources. And really, what that means is that the government, our government, that represents us, that represents our money, our taxpayer money that's coming out of our paychecks. Our government has to put money and resources behind, housing, healthcare, et cetera, for Black and Brown communities and anyone else that is lacking in those things.
Right now, I see things get worse before they get better. I'm boots on the ground. I'm out 6 o'clock every morning. I watched the news the other day, and now I'm watching all these individuals who's about to get evicted out of their house because of COVID. What's going to happen to these people? Going into the shelter system, being homeless on the streets. It's only going to add to the fight that we're fighting right now. You know what I'm saying? God forbid this happens, man. We look at the drug supply that's being tainted. As my brother Howard Walker said, not being tainted, it's drug poisoning. I'm saying people are dying like that. You know what I'm saying? And to be playing this political game with people's lives, man, it's atrocious at this moment. This is 2023. We shouldn't even be in a moment like this. You know what I'm saying? If you look around the world, universal health care, affordable housing, things of that nature, you know what I'm saying, that other societies have. But because we're so much on capitalism, man, people like us, we always at the bottom, man. We have to struggle. And it's a shame that things are getting worse every day. And Kathy Hochul, other legislators have the power to change these things with a drop of a pen, signing an executive order for a lot of things, making housing affordable in communities. You know what I'm saying? Healthcare, all these things could be addressed. But the issue isn't. And the question is, why aren't they doing it? What is the problem?
And I just want to point out that the governor said she was going to be signing an executive order to reduce the amount of robocalls, right?
Mm-hmm.
Okay, I just wanted to say that.
Mm-hmm. So I'm gonna say this, and thank you for saying that. And the thing is this. So a lot of times in harm reduction, people will hear me say, we need to stop speaking to like-minded folks. And what I mean by that is through education. We need to speak to people on the other side of the fence, those people who don't know about harm reduction or against harm reduction. And I would want to, only thing I would want to know is, why are you so against something that saves lives? Harm reduction is a viable modality. Look at all the money that's coming into harm reduction right now. But now that it's the new sexy, there are going to be some people getting harm reduction money who don't deserve it. Mm-hmm. Because they ain't practicing harm reduction. They all of a sudden find out a harm reductionist because of the money. When some of us have been doing this for years. And now we won't be able to get some of that money when it comes out, because now we got these fly-by-night folks coming out. Now, I know that's another issue, but we have to ensure that the right folks are getting the money. We have to educate the community and the media and the politicians. It goes through education. We say in harm reduction, people continue to do what they do for the lack of knowledge, for the lack of knowing. But once you educate folks, when you know better, you do better. So we need people to know better so that they can do better, so that they can vote better, and come along on our side on the issues that we know is right. Treating all people with dignity and respect, treating them with humanity, loving people, loving them up. because a lot of times they've been downtrodden for so long where they have almost ready to give up, and we ain't giving up on anyone. Black, white, brown, indifferent. We're not giving up on them. We don't condone, condemn, or endorse any behavior, but we're there to help someone to save and to change their life when they're ready.
Thank you all for sharing that. It's a topic that people seem to overcomplicate, and the way that you are breaking it down makes it seem truly simple. And there's something that you've been emphasizing, all of you, through this conversation is around harm reduction. And so, like, I just want to ask you, like, how is the approach of harm reduction different from other approaches that have occurred when it comes to people who use drugs? What makes it so special?
I mean, harm reduction is inclusive. Harm reduction is not. We don't tell people what they should do. We meet people where they at, and I know a lot of people have heard that before. So wherever somebody's at in their journey in their life, we meet them right there without judgment, and then we provide them with a sense of well-being. We treat them by their name. We treat them with dignity and respect. We show them love and compassion. You know what I mean? And then we show them certain options. A lot of times people want to work on um, getting people to stop using drugs, where in harm reduction, we want to build the person up. And whatever they want to work on is what we help them to work on. If it's about getting your kids back, if it's about getting an apartment, if it's about taking a shower, sometimes the simplest things are the things that people need the most of. And once we educate people on certain things, then they tell us what it is that they would like, what it is that they need, and we help them to get those things. And then eventually, guess what they talk about? They start talking about their drug use and how much they don't want to use, and how about getting in the detox. But they already worked on some other things, and we ain't even push them that way. We make them feel a part of and included. We make them feel as if they are somebody once again, because they've been broke down, they've been beaten by society, telling them that they ain't nobody. You know, just making them feel inclusive, a part of, and loving them up, calling them by name, and not punishing them. I mean, I'm not gonna. If I'm a harm reductionist, so if somebody want to go to a treatment program, a 21-day program, whatever, I send them wherever they want to go, and I don't talk them out of it because that's what they want. But the first thing that I do is I meet people, I speak to them, I call them by name, and I make them feel as though they are somebody. Because guess what? Everybody is somebody.
I mean, Solomon, for me, as I stated, I am harm reduction. Harm reduction saved me. Harm reduction addressed the pain in my life that I was going through. That immediate need that I needed to release by putting me in a safe space to address that issue, to help me move along in my life. Because while I'm dealing with that pain, there was my drug use to medicate those feelings. And until that pain was released out of my life, I was going to self-medicate. So harm reduction showed me a way to do that. It put me in a space where people I can trust. It put me in a space where people did not call me a crackhead, a junkie, a dope fiend. People didn't spit on me. People didn't tell their child, don't go near me. It brought back to me that I'm a human being and I need to be treated like that. And this is what we do in harm reduction. We treat people like they're human beings. We treat people like they want to be treated, man. And until we could come to a level in our community where we're going to treat people the same as we want to be treated and not ostracize them, not make them look like aliens, they're from another planet, we're not going to get anywhere. People need to realize something, man. That old saying that we say, man, is true, man. It takes a village to raise a child, man. And we have to understand that we need to help our brothers and sisters, because that's only going to uplift our community and make it better. You see this being done in other communities, man. And people need to really take a good look at that, because the other communities, they're going to help their people. They're not going to let them stand there like that. We've been taught to fight against each other.
Hmm.
We need to stop that, man. And this is what harm reduction is about. Make a new thing, because you are in a position now to start making your own decisions, man. That's what it did for me. Once that pain was released, I was better off making decisions that was going to help me better myself, man. That's what it's about, brother. I am harm reduction.
We need society, though, to take care of the issues, that the social and economic issues that it needs to take care of. We need them to take care of the mental health within our community, to assist with that and not lock people up for having mental health issues. And I can go into a whole other things, but go ahead, Jason. I know you're about to blow it up.
Thank you, I appreciate that. Excuse me. So, harm reduction, it's different than other approaches because it's, like everyone said, it's client centered. It's really, really, really about who the most vulnerable person is, right, in the room. It's about providing low threshold services and eliminating barriers. And we want to talk about meeting people where they are, and I'll give you an example of that. Terrell came across someone who's a drug user and pregnant. He did his best to engage her into services and care, as opposed to judging her for being out in the street and not having been engaged with a provider and being an active user, right? So he identified that she did want to meet with a provider. Instead of sending her somewhere or telling her to go somewhere, we said, we'll bring you a doctor right here to the street corner where you are. And so we met her where she was at, literally. We mean that in the most literal sense. We cannot force expectations on people in harm reduction. We cannot, issue punitive measures. Like that's not what it's about. So from there, eventually they were able to, get this person into the clinic and get them the care they needed. But in addition to that, you want to talk about eliminating barriers in harm reduction, right? That person had a partner who was not trying to let her out of his sight. So we eliminate that barrier. You get to come too. You need help. You need support. We can help both of you, right? This is while essentially it is about, right, the child or the pregnancy. It's also, we're gonna do what we have to do to get this person the help they need. So just being innovative and thinking of outside of the box and outside of the traditional ways of doing things, but while also remaining client centered.
And doing that without judgment. And this is the hardest part within harm reduction, because we all have biases. But the thing is, through our training and through doing this work, we most of us recognize and we know when we need to ask for help, when our biases come up. You know what I mean? We still can't put our biases on other folks like most other people do, or put our judgments on them. We don't judge. We don't put our biases. We don't say, well, I think you should or you need to do this, because at the end of the day, we don't save anybody. They save and they help themselves through the education and the work that we have put into them and guided them through. They make the decisions. We just help to walk them through it.
We give them the tools, man. We help them get to a certain degree in their life, a certain path, and we let them make decisions. And even if they make a bad decision, we
Is that a
don't
part of life?
crucify them, man. You know what I'm saying? Okay, you made a mistake. Okay, let's think this through and see how we could do things better. We celebrate incremental changes in
The
people's
smallest
lives.
things.
The smallest little things, man. We celebrate those things with people because it's so hard, because they never had that, man. They're always ridiculed and put down. Even if they did the little thing, oh, well, how long that going to last for? You only did it for the, but we don't do that, man. You know what I'm saying? We break that.
And what does that do? That helps to build up someone's self-esteem. Someone's like the little train that could. You know what I mean? I think I can. I think I can. With us, we know you can. We know you can. We know you can. And then they do. And then when they do the small things, then they start doing the bigger things. And then it's like, oh, they can. And even when someone wants to come to, wants to start a job, we don't try and set people up for failure. but we don't have expectations either. But one thing we do say is, well, did you think about your pet care, your health care, your doctor's appointments? Are you ready for a 40-hour-a-week job? You know, so that way people could think about certain things that they may not have thought about, because everybody wants to get back in the work field. But what happens if that person tries to get back in the work field and everybody else is saying, oh, you messed up, you failed, you'll never be a success? Well, we're saying, are you prepared to go to work? Are you prepared for this? Okay, you know what? You tried it, you wasn't ready yet, but you're gonna be ready. Why didn't you succeed this time? You didn't succeed, or you didn't make it. You succeeded in getting the job. That's part one of the success. You didn't keep it because of why, and we find out why. Oh, then we knock those barriers out the way so that the next time they don't feel like a failure and they succeed. So working on the whole person holistically, mentally and physically, to get them back into society so that they feel a part of, I can do it, I am somebody, I matter, and I'm not gonna, and then they get the attitude of simply, I'm not gonna let nothing stop me. I'm going forward, not backwards. And even if they go backwards, it's not punitive. Exactly. What happened? What you going through? Why you didn't call me? Let's talk. You know what I mean? So they can talk through whatever they need to talk through, so that way they know that they're not alone. Because no human being wants to be alone. And a lot of people use mostly when they're alone, they feel abandoned or they're going through something. We provide a safe space for people to talk about whatever they need to talk about and talk through whatever they need to talk about.
In harm reduction, personal development before professional development is our motto.
Wow.
I also want to add one more quick thing. We've been talking a lot in this conversation about overdose prevention centers and harm reduction centers like syringe exchanges, right? Which it's a very specific example of harm reduction in action, and it's amazing. But also my message to anyone listening in New York City or anywhere in the country or in the world, harm reduction is something that you can practice in your own life, whether or not you use drugs, but with the people around you, your friends, your family, your loved ones. If they're using drugs, whether they quote unquote are addicted or not, you can practice harm reduction if you have a child or if you have a parent by not always not always jumping to want to punish them by kicking them out of the house or banning them from hanging out with their friends or going to a party or doing this thing or that thing, but always trying to put safety first. So you say, okay, you're drinking with your friends or you're using cocaine or heroin. Are you sharing needles, or do you have sterile syringes, so that you prevent transmission of HIV, hepatitis C? Do you have, if you're going out drinking, do you have a ride home? Do you need an Uber or a taxi? Do you need me to come pick you up? If someone needs to go to treatment, like what can I help? How can I help you get to that point, instead of just saying, either go to rehab or you're getting kicked out. So I think it's something very real that we can practice in our daily lives with anyone that we meet that might be either in a bad situation or at risk of creating a bad situation for themselves. We can intervene and just try to keep them safe. And that's really what it's about.
Thank you so much. Oh, wow. I think we're just scratching the surface here right now, right? On the amazing ways in which we can change lives, transform communities. And we could probably have this conversation for hours and hours, because there's so much that we didn't get into, and there's so much more to be discussed. And I'm so glad that we were able to just at least touch upon this, given the fact that there's many ways to approach dealing with the problem of overdose. And often it doesn't come from the context of the racial disparities that were mentioned on this conversation. And so, I definitely have been educated on the facts of the way that people have been historically put in a position to have a lack of resources. That lack of resources has also contributed to emotional trauma from the stress and the environment from the lack of resources. And I think it's safe to say that most people who are using drugs in a way that's dangerous to them are doing so in a way to heal the pain or to stop the feeling of the pain from causing even further destruction in their lives. And so I'm grateful that there's individuals who have lived experience, who have seen their own lives and the ways in which harm has been caused to it, and taken the step, the bold step to have the courage to help another person up. And then these are the people that are on this call today. And I'm so really grateful that New York City has been able to see just a sliver of the importance. And I just wanted to circle back to the things that really need to happen to make sure that this expands. And we're talking about authorizing the use of overdose prevention centers on a statewide level, something that our governor has a power to do through executive order, something that's been presented by our senator, state senator Gustavo Rivera. We also need to have pre-hearing diversion, pre-arrest diversion, pre-detainment diversion that's being right now discussed on the statewide level with a legislation called treatment, not jails. There's a another bill again by Gustavo Rivera who's trying to decriminalize the schedule of drugs so that we don't create a pipeline sending people to further incarceration. And it's funny because we're talking about non-punitive ways to engage folks. And recently, the New York Times put out some opinion piece around the use of mask mandates and the ability to help save lives by reducing the transmission of COVID. And it's found that it's not that masks don't work, it's that mandating the masks weren't working. And so if we were using a harm reduction approach, I wonder how many more lives would be saved during the pandemic. But all that to say that what people need is to be humanized. People need to be looked at for the fact that they are someone in this life that deserves dignity, deserves respect, and deserves access to health, access to safe housing, access to community that will embrace them in a way that will build up their lives. And so these are the things that we need in New York City. We don't need any more lip service. We need 24 hours a day of overdose prevention centers being open. We don't need any more death occurring. So I'm urging, folks on the city level who are listening to this conversation to really push and to let people know that overdose prevention centers are not being funded as overdose prevention centers. The money is going to syringe exchange. If I'm not mistaken, or correct me if I'm wrong, the
Correct.
funding is not going directly to OPCs. OPCs are running off of private funding right now. And although the city may support the idea of it, we need to find a true pathway to make this happen on a city level. And there's another missing piece that I know all of you discussed, but we didn't really mention here: the need for peer navigation, the need for a peer workforce that is embedded into New York City health and hospitals that will be able to expand the service delivery that's currently taking place in a meaningful way that will give staff injection, so to speak, and that would help lift people to a greater place of meeting people where they're at. And that's what needs to be done. That's what we're convening this conversation for, so that folks can realize that although there's steps being made, we have so much further to go. And the further to go is in our own hearts to recognize that people are indeed people and they need to be served to be able to be lifted up rather than be put down and made to feel other than human. And so I'm just going to ask the panelists really quickly, just pass it off to everyone just to share one final thought. If you think, what is the most important thing that people need to walk away from this conversation and what they can do in the future to help save lives as well.
I'll say this: community help community. Don't walk past that person. Give them a conversation, make them feel like a human being. Uplift their soul.
Um, I'm going to say when we talk about peer support, we need to talk about peer support, community support with a livable wage. Um, and at the same time, we need to have a political will, a community will, or the willingness all around to create and to make change and to love each other.
I just I want to leave you all, and I want to thank the Office of the Public Advocate for having me on the panel. I really truly appreciate it. And for my final thought, just move with love and grace and compassion. Um, you know, everyone is fighting. Everyone has their own struggles and is fighting a battles that none of the other of us know about, right? Like we all don't know what each other are going through, really. So, it's always important to move with that grace and that compassion. And just want to leave you all with that. Thank you.
Yeah, and I just want to second that. I want to thank Solomon and the Office of the Public Advocate for allowing me to be on this panel and to speak my truth on this particular topic and this subject. Thank you very much for allowing us to have this venue to speak our truth. Thank you, and we appreciate it.
And I just want to echo those words too. Thank you, Solomon, for allowing us all to be here. And I just want to thank everybody that took the time to listen to this panel tonight. I hope we said something that will resonate in your mind, you know what I'm saying, to help us combat this effort, this senseless war that we're fighting right now. Thank you.
I'll just leave by reminding everyone that all of these problems that we've been talking about, that we've been dealing with for such a long time, there's always some reason that we can identify why we're seeing these disparities, and there's always a solution. So don't lose hope. Don't give up the fight. Get involved. Learn from some individuals such as these, and just get involved in what's going on in your community, because we can make things better. And thanks everyone for having me and for sharing this together.
Thank you all again. If folks can, before we get off, throw some in the chat your information for the public, the website On Point NYC, Filter Magazine. Just thanking National Harm Reduction Coalition and all the people that are involved in this struggle. It's not something that we do because we think it's a good policy. People who are on this call have been impacted in their own individual lives. I myself was a person who has, lost my first cousin to an overdose. And at the time that his life was lost, I was of the mindset that was something that he might have deserved because of the choices that he made. And it was only through being educated properly that I understood really the truth about what harm reduction means and what life-saving service delivery truly is. And I miss my cousin very deeply. And I wish that he could be here. And I wish that in that time in my life, I was able to truly share with him life-saving thoughts, a loving embrace, and holding space for that person to change. And then since then, I've lost many other people. And so I'm grateful for those who have continued to do this work through that pain, have continued to educate themselves. And as we leave, I just want to take a moment of silence for all of those who we've lost in this drug war to overdose and to other violence. Just honor those lives. Thank you, New York City, for listening. Thank you for being here. Thanks again to the folks from On Point NYC, Harm Reduction Coalition, the Peer Network of New York, Filter Magazine, and all those individuals out in New York City who are listening. Thank you for investing in this time. And I hope that through this conversation, we'll continue to change. So Until the very next time, have a wonderful night. Stay blessed. And remember, save a life.
Peace out,
Well,
people.
Thank you
everyone.
all.
Take care. Thank you. Peace and blessings.
Yep.